Hi, Professor Louie. This is Jeff Spitz at Kentucky doing our presentation on the sports medicine device industry, and then we'll also discuss our company of choice, which was Conventus Orthopaedics. So for the agenda for this presentation, first we discuss what sports medicine is, what the device industry is like, including its market size and growth outlook. Then we'll discuss how we segmented that market, followed by the distal radius fracture market. Wrist fractures is how we're defining that. Then we'll discuss our company, Conventus Orthopaedics, which is a startup medical device company. And then following that, we'll be discussing what issues the company is having, and then what our recommendations are for that company. So, sports medicine devices. Sports medicine devices, it's its own field of medicine, and sports medicine devices are used by professional athletes, non-professional athletes, and the everyday person to enhance performance in sports, to recover from sports injuries, and to prevent sports injuries. And these devices can be used externally for people. They can be surgically implanted, and these devices are also used for surgical procedures. And a big trend right now is for less invasive procedures, and that includes laparoscopic and arthroscopic surgical devices. So with the sports medicine device industry, these are the key stakeholders, and it includes the FDA, payers, CMS, and private payers, the customers, and then the medical device companies. And the FDA is focused on efficacy of products as well as safety for patients. And then the payer group, CMS, and private payers are interested in low cost, that the devices are going to be effective for their patients, and that they're going to be affordable too. For customers, the different customers would be professional athletes, like I mentioned, everyday people, and non-professional athletes. And they're looking for devices that are affordable, for devices that will be effective and help them recover faster. And the medical device companies want to be approved for their devices. These are the different ways we can segment the market by product and by application, and we decided to focus on fracture devices and then by application for wrist fractures. This is the market size and growth for sports medicine devices. The annual growth is 5%, and in 2020 the market is supposed to be up closer towards $9 billion, up from about $7 billion in 2014. And real quick, a lot of this growth is being driven by demand for patients for these devices that help them recover faster, and then also from technology that is improving how surgery can be conducted less invasively. So this is how we further segment the market to wrist fractures. It's one of the most common sports injuries, especially with the physical contact sports. And we found that the total distal fracture market is about $3 billion. And then we found the market size for wrist fractures by dividing that number by 6, because 1/6 of fractures treated in emergency departments are wrist fractures. And the next part of our presentation is going to focus on Conventus Orthopaedics, which is a medical device startup. And we have a video that you can watch that really explains this type of technology. But their device is the first three-dimensional implant for helping to solve wrist fractures. And their business model is pretty standard for medical device companies, business to business. And then their market entry strategy is focused on trade shows, demonstrations with surgeons, and also advertising on YouTube.
Thanks, Jeff. And with that, we wanted to go a little deeper into how the market works for Conventus Orthopaedic, and it's reflective of monopolistic competition. Companies like DePuy and Stryker have very large market shares, while 33% of the market is actually made up by a number of smaller companies like Conventus. And Conventus operates in this with both a number of strengths and weaknesses and opportunities that exist. So some of its strengths are an excellent management team with over 20 plus years of industry experience for all individuals on their executive team. They also have strong patent protection. However, that came at a price. Initially, they expected to have a 510K process, quickly approved the process, but instead it took over 3 years and resulted in very limited capital for the company. The new management team was successful in raising capital 3.5 years ago, but that runway is starting to run out as the company looks to expand. However, the company does have a number of opportunities in the broader market that should allow it to have more investments. Some of those opportunities include a demographic transition, as well as more demand for sports medicine that is specialized and less invasive for athletes as well as non-athletes. Some of the weaknesses that they face are a high reliance on their few customers that we'll address in the next segment, as well as the risk of FDA turning against their product, or simply some of these large competitors who are increasingly competing in this field deciding to fight hard on their technology and working around it in slight ways. So, the 3 areas that we identified for improvement was first, their customer base. It's very limited. They only have 5 current customers within 3 states. Second, we recommend that they expand the scope of their product. They've focused on the distal fracture market, but they can expand this to the upper and lower extremities. Third, we recommend that they find some ways to restructure their finances or raise new capital for the future. So the first recommendation to expand their customer base focuses on publishing. Despite the organization's patent protection and extensive executive team with physicians, they've published almost nothing. A quick search of Google Scholar, as well as the company's website, doesn't even highlight any published articles. We recognize that one of the best ways to get physicians to adopt a technology is through publication and key stakeholders. On this, they've done well. They have the Mayo Clinic, but they haven't been able to translate that endorsement and use of the product into other facilities. We recommend that they try to get a few other key opinion leaders on board to then establish themselves in other areas. A second way that they can further expand their sales is by looking at a number of different areas. Instead of focusing on the distal fracture market, which is the wrist, which is one of the most highly competitive areas, they can expand to the upper and lower extremities, such as elbow and shoulder, or the knee. This is an area that looks promising. Interviews with physicians show that while they're very satisfied with the technology that exists for wrist fractures, such as the Boulder plate and new hybrid models, they are unsatisfied with existing solutions for upper extremities, especially the shoulder. And this is an area where the non-invasiveness and quick recovery offered by the Conventus cage can really expand their market opportunity, and eventually they might be able to re-enter the distal fracture market with greater support and a larger market share. However, until then, they can focus on some of these smaller markets to build up key constituents and opinion leaders behind their idea. Finally, we recommend that they try to raise new capital. However, before they give up equity, they should attempt to restructure some of their agreements. One way they can do this is by renegotiating their existing contracts with the facilities that they already have and distributors to negotiate it so they have lower payments currently, and in the future potentially higher payments from their distributors, and their customers offer them higher payments now with lower payments in the future. This will help their balance sheet in the short term to accomplish some of the sales missions that we've offered the target. Additionally, they can attempt to raise more venture capital money. However, that will come at the cost of equity. We think it's possible for the new management team to raise it, especially with their recent FDA approval of new devices and beginning of expansion into other markets. However, we recognize that this is uncertain, which is why we recommend that the company attempts to find an exit strategy, potentially being acquired by one of these larger players in the market. The market forces increasingly suggest tighter consolidation in the field, and from that, it's an opportunity for Conventus to sell a lot of their intellectual property to these large players increasingly looking to consolidate their power. Thank you, and have a nice afternoon.